Apraxia of speech in children becomes apparent as the child emerges into expressive language. Children will know exactly what they want to say, but when they attempt to say it out loud, the motor planning of the tongue, lips, and jaw is inconsistent or absent. Apraxia of speech can coexist with one or more other disorders. Most commonly, children with apraxia are born with this condition rather than developed from TBI or other brain-related incidents.
When children have apraxia of speech, their receptive language is within normal limits of children their age, but their ability to use expressive language is severely impaired and oftentimes absent and/or unclear. This is the primary indicator the child is experiencing more than just delayed speech.
In the event you suspect your child might have apraxia of speech, a speech-language pathologist will be the most qualified professional to make the diagnosis. The SLP will take a history of your child's development and perform an evaluation including, but not limited to, an inventory of sounds, syllables, and a language sample. The SLP will observe how your child combines sounds and record observations about your child's length and ease of utterances. In this process, the SLP will also observe your child's respiratory system to determine whether the child produces adequate airflow. If apraxia is suspected, the SLP will do a motor speech exam. The top three characteristics of apraxia in children are inconsistent errors with consonants and vowels, difficulty moving from sound to sound or syllable to syllable, and inappropriate stress on syllables and words.
As stated earlier, in most cases of childhood apraxia, the cause is unknown. Apraxia in children is not because parents didn't talk to their children enough or because they use inappropriate language such as baby talk. Apraxia in children doesn't occur from the decision to send or not send your child to childcare. Some possible causes, however, are genetic disorders or syndromes, stroke, or brain injury.
Parents of children with apraxia of speech may be worried for their child's future, wonder how the condition happened to them, be confused by the condition, and wonder if everything will be okay. It is perfectly natural to have these feelings, and it is okay to express them. In coping with CAS, follow some of the following steps. First, it is okay to be mad at the world for a while and be frustrated that this happened to your child or family member. Next, educate yourself. Find out as much as you can about CAS, resources that you can use, services, connections with the CAS community where you live, and strategies to best help your child. Finally, find others who have gone through the struggle and support each other. Your speech-language pathologist can also help advocate and find support services for you as well.
When it has been determined your child suffers from childhood apraxia, beginning to see an SLP is of utmost importance. The frequency of speech therapy will vary, however 3 to 5 times a week is typical. Several other considerations when dealing with a child with apraxia will include the amount of practice that is done at home with a caregiver, how much the child is able to tolerate, and the presence of other speech or language difficulties or disorders.